In public health, what we look at is trying to create conditions under which people can be healthy. So we try and prevent entry into our health delivery system. And so historically, the huge strides that have been made, which sort of coincide with principally the first half of the last century, 1900, 1950, were measurable outcomes related to infant mortality rates and life expectancy rates in this country. Huge strides, and 80% of all of that change was driven by public health sorts of changes. I view public health interventions as inclusive of things like economic development, improving educational environments. All of those things will create better conditions where people will be more healthy. So I see the public health school getting involved with colleagues in other colleges on the campus, education, for example, to try and do some things to improve conditions in, for example, the West End that might be very helpful in terms of creating a better environment for a healthier population. So that's one dimension that we want to work at. I want to see our school get engaged in some very visible global health initiatives. In fact, if you look at the top 25 schools of public health, they're all doing global health initiatives. But there's only 5 or 6 that are really doing substantial things. So I'm hoping that our school will get engaged in an aggressive way in some global settings. I think the third signature thing that the school really needs to partake in is another interesting dimension. If you look at workforce in public health, broadly defined, there are needs for workforce at the undergraduate level as well. And so if we're going to be a responsible school of public health, we should in fact be looking at the needs of the workforce. So I think we're going to move quickly to implement an undergraduate program here at University of Louisville that will probably start fall of 14.